A very large number of women in the country are potentially affected by cervical cancer. Cervical cancer is a disease which has a viral origin. Viral infections over a long period of time can manifest as a tumor, and therefore this turns out to be a disease which is perfectly curable if the viral infection is detected at a very early stage. Unfortunately, in the country, most people in the interior do not come forward for screening, and as a consequence develop full-blown cancer, and the chances of survival at that late stage are very low. So effectively, there's a need for a technology which can be taken into the field for early screening of women and for diversion of positives into tertiary care facilities for further investigation and treatment. So the attempt effectively is for the infrastructure that is currently available at tertiary care hospitals for cervical cancer screening to now be moved into the field and to evolve a paradigm where paramedics in the field are capable of executing the whole screening program. So the technology we are trying to assemble to tackle this cervical cancer screening project is in two parts. First, we are trying to build a screening device which will help visualize the cervix of a woman in the field. Currently, a woman is expected to come up to a screening room in a tertiary care facility for investigation. The attempt is to take a visualization device into the field and have a paramedic deployed. This involves essentially painting the walls of the cervix with a paint to visualize lesions, and then deploying this inspection device to illuminate and then image and record the lesions that are observed on the cervix. The device has to be used by a nurse in the field, and effectively this requires a second element to the project, which involves training a field worker, a nurse, to handle this device and to record images of good quality. So the target audience of this technology is primarily the women who are in a rural setting who have very little access to quality screening care. But once built, this technology is probably also relevant to urban slum settings where women can avail of this as a service. The age group for which this screen is required is primarily 30 plus and more so for the 40 to 50 age segment. But in theory, this can be used for gynec level inspections of all kinds of scenarios, and therefore all age groups. There are no comparable solutions available at low cost in India. There are imported solutions from Sweden which are extremely expensive. We think that the costing of this device will finally be an order of magnitude, if not 2 orders of magnitude, below what they currently cost. So the inspection device, we have a prototype working at this stage. It needs to undergo field testing and effectively a clinical trial. We expect to get that done by the completion of this project in May 2016. There is already progress in defining a syllabus for the field worker, and that as well will get completed by this deadline.